Good afternoon, everyone. Once again, my name is Rudy Page, and welcome to another of our forums. In fact, this is a symposium, and this is will be known as the Women and Girls Health and Wellbeing Symposium. So it's about building healthy communities through education, physical, mental, and spiritual health. We also, with this particular forum, we're focused on knowledge sharing between countries, cultures, and systems for implementing National Development Plans 2030. So this forum is aligned with the UN Sustainable Development Goals, with a particular focus on gender equality. So having said all that, we've got some great speakers lined up, and I'm really pleased to introduce our co-host for today is Ernest. Ernest, how are you, sir?
Good afternoon, Rudy, where you are, and good evening to everyone else here down here in South Africa. Are we all good tonight?
And I think everybody's good to go.
Excellent, excellent. All right, without further ado, I just want to thank all of you for coming out and joining us in this first Women and Girls Symposium, which of course will discuss, amongst other things, as Rudy said, health and well-being, knowledge sharing, and all that goes with really building healthy communities. So indeed, we have a fantastic lineup. I see we even have a sign language interpreter for those that are challenged with hearing. So it's a fantastic evening indeed. Without further ado, I guess I should introduce myself. My name is Ernest. If you pick up any sound quality deteriorating, please just put your hand so I can come closer to the microphone. I'm the program director for eCenter for Women's Cancer and Maternal Health. And what we do, basically, in a nutshell, is that we are a nonprofit, focused primarily on, prevention, detection, and of course, survivorship of people that, are affected by cancer. Women and family, of course, we do not have any exclusion. So in a nutshell, that's what we do. We'll drill deeper as we get further into the program. For now, though, I want to introduce one of the speakers on the panel, starting with Marisa. Would you like to please introduce yourself to us?
Hi, Ernest. Hello, everyone. Can you hear me clearly?
Yes, we can hear you, Marisa.
Thank you very much. My name is Marisa Lowe. I'm a breast cancer warrior, and I live in a small countryside town about an hour and a half's drive south of Johannesburg called Parys in South Africa. And yes, I met Ernest. I'll tell a bit more about how we met when I get my speaking opportunity, but I'm here to encourage other people who are on similar journeys or who know people who are on similar journeys, so that they can get all the support and all the proper care that they need, no matter who they are or where they come from.
Thank you.
Excellent. Thank you so much, Marisa, for that short and sweet introduction indeed. Our next, of course, person to introduce themselves is Natalie van Blurk.
Hi everybody. My name is Natalie van Blurk, as Ernest said, and I specialize, one of the things I specialize in is corporate wellness, helping companies and the individuals in their companies to be more well and to be able to then be more productive. So that's where we specialize in, and I'll chat to everybody just now.
Okay.
Excellent. Coming again on board, it would be Natalie Schippers.
Good evening, everyone. Is it afternoon where you're sitting, Ernest? Thank you for inviting us. Natalie Schippers, I'm a safety professional advisor corporate advisor, and today I'll be talking about issues in the workplace, safety that women can pay attention to, and how workplace policies can work for them or not work for them, and how to speak out or speak up when issues are not working in their workspace. So I'm from South Africa. I live in Johannesburg, more so Boksburg. And thank you for inviting me, Ernest, and happy to be here. Thank you.
All right, thank you so much for that indeed. Ms. Konse, you're next. You can introduce yourself. The floor is yours. All right, I think she's on mute, so we're gonna move to Debbie. Debbie, can you introduce yourself, please?
Thank you, Ernest, and hello, everyone. My name is Deborah Ngoma. I am from Cape Town, a cancer survivor, specifically breast cancer survivor. I am a vision bearer of a ministry called Deborah's Conversations. Thank you.
Thank you.
Excellent. Dr. Rhoda, would you want to come in and introduce yourself, please?
Good evening, everyone. Thank you very much, Ernest, for this opportunity. I hope you can hear me clearly.
Yeah, we can.
We can hear you.
Brilliant. I'm Dr. Rhoda Jura Creek, and I'm a medical doctor and CEO of Amber Medical and Travel Clinics, which is a healthcare organization in Nairobi. And I'm here to speak about the role of technology in healthcare, which is a passion of mine. So I look forward to it. And thank you very much, Rudy, for putting this together, Rudy and Ernest.
Thank you.
Thank you so much, Dr. Mary.
Yes, good evening, everyone. I'm happy to be here. My name is Dr. Marie Claire Wangari. I am a project manager at Africa Health Business, as well as a general practitioner based in Kenya, who has interacted with the reproductive health space as a frontline healthcare worker and as one of the founding volunteers of a social change program I pioneered called RESPECT, called Reproductive and Sexual Health Program for Kenyan teenagers, which tries to bridge the gap to access to education, as well as services in Kenya for adolescents and youth. Happy to be here and looking forward to sharing more.
Thank you, wonderful. Ms. Fumane, can you come in and introduce yourself, please? Fumane, can you hear me?
Thank you, Ernest. Thank you. My name is Fumani Dipoto. I'm working at National Union of Winemakers as Youth and Women Coordinator in South Africa. Thank you.
Excellent. That was short and sweet. Next, Ms. Sakani, can you introduce yourself, please? You're on mute.
I did unmute. Can everyone hear me?
Yeah, we can hear you now.
Yeah.
Good evening. My name is Sakani Malinda. I'm a student and I'm an outreach officer for the E-Center. Thank you.
Okay.
Excellent. Ms. Raisa Rose, can you introduce yourself, please?
I'm not sure if she can see the interpreter. Oh, there she can see the interpreter. She goes, hello, everybody. My name is Raisa Rose, and this is my sign name in the deaf community, and I represent women and girls, disabled women and girls in the community in South Africa. And I'm pleased to have this opportunity to speak to everybody today, to speak on behalf of all the people who are disabled in South Africa, especially in regards to some of the issues we face in the country. So yes, thank you very much.
We're also very pleased indeed.
Thank you so much. That was a wonderful introduction. I hope I've covered everybody. If I haven't, would you please just put your hand up?
Right, Ernest, just before we go on, we've got a colleague, Ketty from Campaign Africa, who's just going to say a few words of encouragement to the speakers. So Ketty, if you'd like to come on, please.
Good evening, everyone. And thank you so much for this grand gathering. It certainly has mushroomed into something absolutely beautiful. And thank you, Ernest, for working with Rudy in making this happen. And of course, the work that you've been doing in the past. And this is a great way for us to come together to share ideas. I'm part of Campaign Africa, which is, in a nutshell, then we get behind those who are passionate and campaigning for Africans. And that definitely plays a big role in young people, and mental health, wellness and health are important things. So I'm looking forward to this conversation. Welcome, everyone. Thank you, Rudy. Over to you, Ernest.
Thank you for that.
Thank you so much, Natalie. Really appreciate that warm welcome, and indeed the words of encouragement. All right, so I'm going to quickly take all of you. Not everybody's familiar with the e-center, and I'm just going to quickly, I prepared some slides, just about three, to give you an overview of who we are. I can just quickly share that. Right. All right, so while I do the slide sharing, I could perhaps just take you through without even sharing the slide, because I seem to not finding, I've got too many documents open on my screen. So e-center in a nutshell, as I said earlier, we a non-profit, solely created, established to assist women, to aid women, through their cancer journey, as we always say, the navigation process. Quite often, the work we do is not the most romantic, it's not the nicest of things, it's not like saving people, in war zones, and that it really involves, seeing people struggle, seeing people's pain, seeing people fearing the worst, So you're dealing with people's health. And I must say that I'm really being so lucky together with my team in that we've managed to help so many women, navigate their way through their cancer diagnosis, and it has been a very wonderful experience for me, and a learning one, of course, And in a way, I've since met so many friends along the way. Some of them are here tonight. You'll hear them speak, and it's really very satisfying work. I've never done anything as exciting as this, because to work with other people, really, especially those that are in desperate situations, such as being diagnosed with something devastating as cancer, and you work with them, you hear their hope, you hear their fears. That's the most, I don't think there's anything that can change one's life the way my journey has been working with people affected by cancer. What we basically, how we do our work, we tend to focus on three primary areas of, which is outreach, So we have a philosophy at e-center that you have to go to where people are, as opposed to waiting for them to come to you. So we tend to take our services where they are. In most cases, what we take with us, of course, is education. Tell people, how the whole cancer comes to be. But later, of course, it's not just about cancer. In fact, one of the things we have picked up is that unless you deal with a whole entire spectrum of women's health, focusing only on one aspect is really just a waste of time. So you need to start right from primary health care, because then you can avoid the complexity that comes with things being detected later on when things are much more harder to deal with. I'm not going to go deep into the discussion because we need to open up the forum. There's many of you that need to speak. I will quickly hand over to, let me just quickly have a look at my program.
Yeah, our first speaker, please.
Yeah, first speaker. Okay, so our first speaker, women supported by e-Center, it will be Tsakani Malinda. You can come in. So it's just to give you an overview. So Tsakani, she is one of the young people. I've never really come across young people that are so passionate about their own health and those of elderly people in the community. So Tsakani joined us last year as a coordinator, healthcare coordinator. She's a student and she volunteered her time mainly to reach the faith-based communities, your churches and here in Johannesburg, that sort of thing. But come in, Tsakani.
Good evening, everyone. I hope everyone can hear me.
We can indeed. Good evening.
Yes, as I introduced myself earlier, my name is Tsakani Malinda. I'm 21 years old. I'm a student. I reside in Vaal in Johannesburg. So I was first introduced to the e-Center by Mr. Mhlongo, and I felt so excited because I personally have a first-hand experience of living with someone that is diagnosed with cancer, because I have a family member that is diagnosed with cancer, and that made me interested in being in the e-Center, because then it gives me a chance to help other people that are in need of my help. And I understand the trauma and the hurt, the after effects that comes with being a patient that is diagnosed with cancer, and also being a family member to someone that has cancer. So I have first-hand experience as to how hurting that is, and I know how much support you need when you're at that state. So my main focus will be on the faith-based community, where we raise awareness to them, we give them the support that they need, we give them education that they need as to how do you prevent cancer, and if you have it, how do you then treat it, the importance of attending your appointments and all of that. We give all the necessary support that those people need, and the necessary information and the education that those people need.
Thank you very much for that.
Thank you very much for that. The next person is Ms. Dimpo from National Department of Health, and she'll be coming through. Ms. Dimpo, can you hear me?
Good evening. Good evening, everyone. Can you hear me clearly?
Yeah, we can hear you. Go ahead.
All right. My name is Dimpo Chweneahe from National Department of Health, South Africa, from Women, Maternal and Reproductive Health Cluster. My responsibility is female reproductive cancers in the country, and our main focus is to do oversight, develop policies, and ensuring that all 9 provinces are actually complying with the set prescripts. So my topic for today is more of, seeing that this month is Cervical Cancer Month, I'm going to be keeping my focus around there from the policy perspective and up to the operational level, which is going to be just a brief of all those. South Africa had developed a policy in 2017, signed off, and as well as the guideline that was signed off in 2019. The main focus of our policy is ensuring that there is education and information sharing to the public in terms of the risks, so that we minimize risk and improve survivorship. Subsequent to that, our policy is also focusing on prevention strategies, and our prevention strategies that we have taken very serious is HPV DNA vaccination, HPV vaccination that started in school in 2012. So far, we have made really good strides because we're sitting at, from January 2022, we're sitting at 83% of girls in school between 9 and 12 years being vaccinated. And proportion of the last 17% is actually more of the parents that are not actually signing the consent form, because the policy is before any child can be given the vaccine, the parents must have signed the consent form thereof. And subsequent to that are children, girls that are in private school that are actually not reached out. And part of our prevention strategy as well is running campaigns, ensuring that we do cervical screening. And we have actually different modalities in terms of cervical screening. We were actually doing the conventional smear, but we converted already in 2018 to do liquid-based cytology, which is more accurate in terms of the reliability of the results. And we are in the transition as we talk. We're moving to HPV DNA testing to be accurate. And that is actually in line with the WHO 2020 strategy for 2030 elimination of cervical cancer, whereby there is 90-70-90 strategy in place that South Africa has adopted. For which the first 90 is actually ensuring that all girls between 9 and 13 years are vaccinated completely by 2030. And the 70 actually stands for the use of relevant screening modality to ensure that women are screened for cervical cancer. And the last 90 is actually ensuring that there is management of precancerous lesion. 90% of women who are diagnosed with precancerous lesion are being treated effectively. So we are in line with the WHO requirements as a country. And other than that, our policy is actually talking to the improvement of access to the health facilities. What we've done so far is to ensure that from primary level, there is access for screening. And part of that is to ensure that all other precancerous lesions are actually managed at primary healthcare level, as well as district hospital, whereby the LEDs and the colposcopies are done right there, instead of what was happening before, where patients were actually transferred to the high level of care, which was taking longer for them to be seen before the precancerous lesion could actually develop into cancer. So that is part of the strides that we have made. And with the help of our partners, we have actually identified 3 provinces in the country to champion the HPV DNA, as well as the colpos, whereby the machines were distributed to those 3 provinces. One is KwaZulu-Natal, which was given 16 colposcopy machines, which were distributed even to the primary healthcare level, to ensure that we actually master what we thought would actually save women from cervical cancer. And 35 machines were distributed to Eastern Cape, and 25 of them distributed to Gauteng to ensure that. So as it is, we are actually waiting for the results to see the impact of what has been done, because the process only started in 2021 around June. So we're looking forward to getting results and ensuring that if we get really joy into what we have been doing in the previous year, we're going to be scaling up, ensuring that all provinces are actually doing the same as the 3 provinces. And part of our policy focus is linkage to care and treatment. Initially, patients were diagnosed on time, but they were not actually able to access treatment on time. So currently, the different provinces are mandated by the policy to actually ensure that there are regional units within provinces, so that it shortens the time whereby the patient gets diagnosed, staged, and put on treatment on time to improve survivorship. And for those patients that are not actually eligible for treatment, we have actually made a clear policy in terms of palliative care, because despite the fact that they have reached a level of at a point where they cannot be treated, but at least they must be pain-free as much as possible. So that is our approach. And then, having done all those things, we couldn't do it alone, but we do have partnership from private sector, from our civil society. Just to mention few, we had worked a lot with campaigning for cancer. We have worked a lot with cancer. We have worked a lot with Pink Drive, because Pink Drive is really doing a great job in terms of doing pap smears across the country in specific areas. So in that sense, they're actually improving access to the services, even in the deepest rural areas where some people cannot actually reach. And part of what we have done as the first 90 of the strategy 2030 is that we have actually successfully vaccinated 83% of girls in schools, in public schools. And part of that is that we have actually started what was recommended by WHO to do HPV DNA testing. We have selected KwaZulu-Natal as our province to do the HPV DNA, and our target was 1,000 people. So far, 600 people have already been using the HPV DNA test. We're just waiting for the results to be disseminated so that we can actually roll it out to other provinces. I think that's that from me. Thank you.
Thank you very much for that. Indeed, I think it's a very broad, also comprehensive explanation to what the National Department of Health is doing. I am familiar with some of the, the programs that you guys are putting out there, and indeed, there's so much work to be done, but more has been done in that area of vaccination. And I must give congratulations to you guys with your team. This is the important. Our next speaker is Natalie Skippers. Dr. Natalie Skippers, you can come in.
Thank you, everyone. Thank you for the introduction. So I'm actually a health and safety specialist, and I'm glad that we're talking about health and wellness issues, because it does impact on the workplace. And of course, when women or people get to the workplace, a lot of times there's no disclosure around the illness or the disease, whether it is personal or whether it was acquired from the workplace. So just to shed some light, what my contribution here tonight is that what we want to encourage women to do is to be open and to speak out and to speak up about issues that impact them. Because when you're in the workplace, a lot of times supervisors or managers are not able to access information on the employee in the workplace. A lot of this information are withheld, or sometimes held with occupational health practitioners or doctors, such as the previous speaker. So what we try and do is to encourage the openness in terms of reporting or informing managers. Of course, employees would be would feel that they don't want to disclose because there may be a discrimination, or there may be issues around the workplace, around actual activities or work that needs to be carried out. So from a health and safety perspective, it's very important that there's full disclosure in a safe space, of course, and to ensure that your manager or your supervisor understands what you're going through. For example, if an employee is going through a situation with cancer, or they're receiving treatment, it's best to inform the employer, because that will impact your safety, your cognitive ability in the workplace. And what we call psychological safety, because if an employee feels that they cannot be open, they cannot disclose, they cannot discuss medication, especially in high-risk environments, it will impact on the employee's ability to be functional. What we do want to see and encourage from my perspective is that where policies do not encourage or do not support employees. They need to then be part of the process, part of discussing changes in the workplace. Remember, we are now technically working from home, some of us, so we've become lone workers. So what systems are being put in place or being encouraged that employees report on a regular basis or have face-to-face meetings with their managers, or even the workspace that they finding themselves in. So lone workers is something very foreign to a lot of organizations, because they technically don't really understand that if a person works isolated alone, they're still part of the bigger safety system and they need to be taken care of. You can't just leave them. Just think of a construction worker that must work on a mast and he's up there fixing a telecoms line and he's all alone because he's a technician. How does he communicate? How does he reach out? Does the supervisor have a system where he checks on the employee? And for that matter, a lot of women are now entering that space, becoming technicians, working in construction. And on top of that, we have to deal with working in isolated spaces, and not to mention other things like harassment that's taking place in the workplace, workplace violence, where this will impact on the health and the well-being and the safety of the employee. So we want to encourage employees, women, and all kinds of employees, younger employees, employees that are entering the workplace, that are new in terms of workplace systems, processes, to actually get involved in safety audits, safety inspections, and make sure that they understand their work, they understand their jobs, they understand the requirements of that job. So functionally, if you are supposed to work in a high-risk environment and substance abuse is a problem, you need to then also talk about it, get it out, talk to your supervisors and make sure that you disclose in a safe space, because that can become a problem in the workplace and you can actually impact the safety of others. Now, coming back to females and workers, women employees, we also know that facilities are a problem. If you're working in construction, like I have in many cases, you get to a site and the facilities doesn't cater for women. There in itself, we need to speak up, we need to speak out. Women coming back from maternity leave, suddenly there's no facilities for you to do your use your breast pump or breastfeed or something in that space. You also need to ask the employer if there's some form or shape of accommodation. In fact, our labor laws does allow for that, that you are accommodated in any form or shape if you are still breastfeeding. So women need to take up their space. They need to speak up about health and safety issues that is not suitable. I'm not saying we must be accommodated every nook and cranny, but certainly the employer must ensure, as the law requires, that there are health and safety systems that make us safe at work, make us safe physically, make us safe psychologically. Because if you are working on a conveyor belt and you're on a night shift and there's only two of you, if something happens, how do you interact with the employee? Or if there's safe systems that you need to activate, how do you phone emergency services? What happens to the conveyor belt that you're working on if there's just a two-man shift? So we need that kind of information. We need that kind of communication. We must know what are the workplace policies. How do the policies support us at work, and how do we access? Another simple thing is personal protective equipment. I just want to end up with this, is that a lot of times we're issued with size small, and size small does not mean it's going to fit our women in terms of our anthropology, in terms of our makeup, in terms of how we are. So sometimes we are given personal protective equipment, boots, shoes, clothing items that doesn't actually serve us well because they're not made for women. So policies again impact on our safety and our well-being at work, and we need to make sure that we are part of the solution. We need to make sure that we speak up and speak out about things that does not serve us well. And this month in South Africa, we actually tomorrow, it's Women's Day, a lot of gender-based violence. So if there's violence at work, we know that harassment has been outlawed, even catcalling, talking to women in certain situations where harassment is not allowed. We need to have safe systems at work because we want to be economically productive. We want to contribute, and a lot of us are smart. We know what we need to do in the workplace, but these systems, processes, the environment does not support us being in the workplace. However, it is up to us also to contribute to the solutions that we want to see, speak to the management, speak to the executive, speak to the board, and come up with those solutions where they can see that there's definitely changes that need to be made in the workplace. By the way, it is also underpinned by the Sustainable Development Goals, which we know talks to all of the above that I've mentioned and so forth. So I hope that in the 7 minutes I was able to do justice to the discussion, but there's so many things that could be said about the workplace in terms of even our functional abilities and how the employers should assist us to be functionally well and mentally well and safe in the workplace. Thank you, Ernest. 7 minutes is not a lot, but I thank you for allowing me to speak on this platform. Thank you very much.
Thank you so much, Dr. Natalie. Thank you.
There will be a chance, Natalie, to say a few things later.
Give us. Yeah. Next coming through is Dr. Mary Claire in Nairobi. Doctor, the floor is yours.
Thank you so much. Let me just share my screen real quick. Yep. So my name is Dr. Mary Claire Wangari. I am a project manager at Africa Health Business, and my talk will be on leveraging on partnerships to improve or rather to advance women's health in Africa. And I'll be sharing just a brief overview of an event we held earlier this year, which was our 6th Africa Health Business Symposium, which was, the theme was the role of the private sector in advancing women's health in Africa. Just a brief overview, Africa Health Business is a boutique consultancy, advisory and investment firms, which offers an array of services from business intelligence all the way to stakeholder convening, and then our flagship event, which is the Africa Health Business Symposium. The February one was on women's health in line with International Women's Day, and our 2nd edition will be in November on men's health in line with the Men's Month of November. And the reason we held this women's symposium was because we realized that we have so many private sector stakeholders who play a key role in advancing women's health, whether offering diagnostics, offering advice, offering funding. But when you having a forum to jointly discuss these things, many a times is rarely there, and it's rarely an event where you rarely have a scenario where private sector think, what can we do jointly to also amplify the work we are doing in our various fields. And this goes very timely in even what some of the leading organizations were saying, that women's health is essentially a center point of systems globally and in the WHO. And especially equity is mainly a huge word that comes into play when you're talking about women's health, because women are a foundation of a family, but many a times getting the right access to care is quite a challenge, because as they're taking care of family or going through their careers, some things might fall into the cracks, such as access to equitable and quality healthcare. And AHBS has been there from 2016 on various arrays of topics and themes. And when we did this event, we had 61 countries, out of which 30 were African. And we were fortunate enough to also have 9 ministries of health there and 52 partners in attendance. And with looking from public and private sector, we had about 420 people from the private sector and 101 from the public sector. And this just shows you that when you're talking about women's health, it's everyone's business. And it doesn't matter which corner of the world you're seated at, every country wants the best for their women. And we saw this with the attendance of our event, and we saw it with the side sessions we also had on various topics, including health systems for women's health, including matters to do with certain products, because certain companies did also come and show us their innovations they have. One company, Hologic, even has a women's index that categorizes women's diseases and all the findings they have found when using their diagnostics. And as you can see, our partners were of all ranges, from your hospitals to your development partners to even now the Ministry of Health of Kenya, which held this event, which shows you just how cross-cutting this topic is. And the main things we did focus on was on matters to do with reducing the cancer threat, empowering women through reproductive, maternal, newborn and child health, universal health coverage, and then of course now matters to do with leadership and strengthening the health systems for Africa. And one key finding which I think resonated with me from this Africa Health Business Symposium was this particular quote from one of our speakers, which was, to strengthen and build resilient health systems on the continent, public-private partnerships are very vital, and they leverage on the strengths of both sectors, learning from each other and being harmonized so as to continuously, crucially build and strengthen the health systems which people interact with. And now, after this symposium, one of the key things that kept coming up was how can we all join efforts and hold each other accountable and improve the state of women's health in the region. And one crucial thing that was discussed in one of our side events was on how to have a private sector-driven coalition for women's health in Africa, which I'll just now keep on calling the coalition, which will now try and, if you have diagnostics and I have, maybe I'm a civil society and I'm good at bringing people together, how can we bridge the gap in care? And through this coalition, our hope is to focus on two main things, with the first focus area being reproductive health cancers, and then the second focus area being on maternal, newborn, child, and adolescent health. And the main things we'd like to achieve with this coalition, which we'll be rolling out later this year, are matters to do with knowledge and research, policy dialogue and awareness of the issues affecting women's health, and finally action. How can we improve the state of women's health through the various networks and platforms that we have across the region? Yes, and I think that will just be my summary for that. This is just a nutshell of some of the testimonials that we got from the AHBS that we held. And with that, I'd just like to thank you. And I think my main summary for this presentation would be that women's health is something that needs all hands on deck so as to achieve universal health access. And the private sector does play a key role in that, and it is open to working with various arms so as to achieve this goal. So I think the easiest way to put it is together many hands make light work, and we need all people on board so as to bridge the gaps we have in our care for our women. Thank you.
Thank you.
Thank you so much, Dr. Mary. Thank you, really appreciate that. Our next speaker is, I think my video is, let me see, I'm back on screen here. Our next speaker is Dr. Rhoda, also based in Nairobi. You can come through, Dr. Rhoda.
Thank you very much, Ernest. Can you see my screen?
Yes, we can see your screen. If you can just click on slideshow.
So I'm Dr. Rhoda, and I'm a doctoral practitioner. Brilliant. I'm on slideshow.
No, not yet. We are. Yes, you are now.
All right. So I'm a general practitioner in Nairobi. My organization, Amber Medical Clinic, is quite diverse. We do offer primary healthcare centers in Nairobi. We also work with quite a few corporates in providing curated corporate wellness programs. And I'm glad that one of the speakers is speaking on this today, actually two of them. So probably we'll have a chat after this on any synergies that may exist. So thank you, Ernest and Rudy, for bringing us together. But today I'm going to talk about something that's a passion project of mine, which is the role of technology, not just in primary healthcare, but in self-care as well. Amber Medical Clinics is the organizer of the Africa MedTech Conference, which will be held in Nairobi in 2023. So I am hoping that I will see all of you there. Whether as or partners. So if you're interested in part in this, reach me. I'm very excited about it. So our general practice both in the public health sector and in the private health sector. Now for the last 6 years, I'm running my own health night. I have technology evolve, and not just evolve because of the passage of time, but also evolve when moving from the public health sector environment into healthcare provision in the private health sector. And healthcare is one of those places where we are sort of trailing a bit behind as far as technology, just because of how sensitive this service is. You know, the finance industry, fintech took off years ago, and we are only just coming in, whether it's in artificial intelligence or in robotics. And we realize now, and as we have known, that we cannot escape it. So in primary healthcare, technology is important in education. And I'm glad that the speaker who represented the Ministry of Health in South Africa emphasized on women education, as has Dr. Wangari, getting information out there. And so did Natalie, getting information out there, educating the community on what they need to know. Because one big part, one of the pillars in primary healthcare is public participation. And you cannot have that when the community is not aware of what they ought to know about. So technology advances have improved research, they've improved accessibility to care, improved quality of care, and reducing patient risks, not just because patients know more and patients are more empowered, but also because doctors can be held accountable because there's access to data. You know, there's access to actual patient notes, including timestamps. So healthcare providers, not just doctors, nurses, technologists, are being held accountable. And technology has increased transparency in the delivery of healthcare, which has played a huge role in reducing risks, patient risks. We no longer have healthcare workers as the demigods that have come in to save you. Rather, we have the patient being a partner in the provision of their healthcare. And it is no longer strange to have a patient question the kind of medication they're being given, because they have access to this information at the touch of a button. And then, of course, data quality. I've been running my practice for close to 6 years now, and I have close to 30,000 unique patient visits. And that means if I did not have an electronic system of data storage, I would have a massive file room. And so only is the quality of my data better on my patient care. I also have easy access to this data at the click of a button. I have access to patient records. I can share these records with any physician all over the world. I can download this data in an encrypted form and share it with the patient themselves so that there's continuity of care. So it's brilliant what technology has done. And this is just the tip of the iceberg. There's also robotics and nanorobotics in surgery, which is gaining quite a bit of momentum. And we hope to see a lot more improvement in certain aspects, especially in cardiology. And even the technology in prosthetic limbs, the technology in joint replacement has made a massive difference, not just in primary healthcare, but in tertiary care as well. Now, primary healthcare is a community-based approach, people-centered approach to healthcare, so that the community is integrated. And we cannot talk about communities without talking about women. More often than not, the women in the community, the mothers in the community have a massive influence over how families seek healthcare, the health-seeking behaviors of families. They often direct, which hospitals their families go to, and what more often than not, as far as healthcare is concerned, despite a lot of societies being patriarchal, women are often the center of making disease related to healthcare seeking. And so in primary healthcare, we can't talk about communities without about empowering women, putting this knowledge in hands, so that when it does point of making decisions in terms of where to seek health, what kind of healthcare to seek, and at what point, do you move to the next level of care? Technology is involved in patient communication and education. When you scroll through social media, you'll see massive posts, many posts on influencers talking about mental health and mental wellness. We have doctors now on social media doing health promotion. And I'm sure in the next couple of years, we will have the ministries of health. During the pandemic, for example, a lot of information on COVID-19 was being shared on social media and reaching quite a large audience. So we'll get to a point where each and every person on the planet has access to this information, and healthcare campaigns will hugely be through technology. And electronic systems, like what I have, where I have the system, files, third cloud-based system. And therefore this data not only has longevity, I have easy access to it, there's easy retrieval, there's confidentiality. Nobody can come into my clinic and file case from one practitioner to another. If I am seeing patients, and one of my outpatient centers sees a lot of expatriate clients, and I'll simply download and transfer a file from my practice to the other person's practice. And therefore, it's very clear what I have been doing with this patient when they move on to the next level of care. It makes it extremely easy to refer. And technology, as mobile technology, makes private healthcare very convenient. I make a to call the hospital I am referring my patient to ensure they have beds. We even have hospitals we partner with whose capacity we are able to see. We can see that this hospital does not have IU beds at this moment. I will refer to this other hospital. So this way of storing data, inputting data, extremely important. And of course, disease epidemiology using data technology, data analysis, obviously influence policies, where resources are mobilized to. All of this ultimately results in improved quality of care for the patient, because we are in an era where patients are custodians of health, opposed to medical providers being custodians of health. Applications promote self-care. For example, we've got applications on phones that carry positive lifestyle changes, encourage you to move more. Your phone will buzz it to that time, for example, that do not now. Set a timer on your phone so that every 2 hours, if you haven't gotten up in 2 hours, you get up and you do a stretch, like Natalie mentioned, a lot of from home. and we're working alone. Encourage
Dr. Rhoda, just
these kind of reminders.
Dr. Rhoda, I'll give you one minute to finish, please.
Thank you. So using technology for good is extremely important. And so if you don't have this on your phone, I encourage you to do that. Get wearable devices that, thank you very much, guys, for listening. I think that is indeed my last slide.
All right, thank you very much for that. Ernest, just before you go ahead, I'd just like to announce to everybody that this program is being aired live on womanr.co.za radio, womanr.co.za radio. There is a Woman Radio app which can be downloaded from the normal Apple and Android Play stores. So that's, if you're online, you want to click on a website, womanr.co.za. But if you can download to your phone, then it's just Woman Radio from your app store. Thank you very much for that, Dr. Rhoda. You've raised some great points there, which I hope we will come back to later on from a system point of view, but it would be good to hear how patients have been enabled for their voice to be heard, and and what response has been from the system and clinicians to that feedback from patients as well. So hopefully we will touch on that as part of the overall dialogue later. Ernest, back to you.
Yeah, thank you so much for that, Rudy. Dr. Rhoda, thank you very much for the wonderful presentation indeed. Our next speaker is Miss Natalie Blurd. She'll be coming through. Natalie, the stage is yours.
Thank you very much, Ernest. Thank you and Rudy for having me on the show. So as I said earlier, I am a corporate wellness coach. I work with, at Pela Wellness, we work with corporates to ensure they create this culture of wellness in each company. And a few of the speakers have spoken about corporate wellness. So my angle tonight will be on personal wellness, which forms part of corporate wellness, of course. And I'd like to encourage each person to turn their focus now on themselves. Everybody listening, everybody speaking, let's look at your own wellness and just sort of try and think how your inner wellness is. And before I start, it's interesting, the human body has roughly 30 trillion cells in the body. The brain has roughly 86 billion neurons all talking to each other and communicating. So the people we are and the person we are is an incredible being, and our inner wellness obviously affects every single cell. So I thought just to focus now and think about yourself, because I want to talk about investing in your own personal wellness. So I'm just going to quickly share my slides. Yes, talking today about personal wellness versus corporate wellness. As Dr. Nat said earlier, corporate wellness, corporate safety, very, very important. But I'm going to just chat quickly about your personal wellness and how important it is to invest in this personal wellness. And when we talk to clients, we say, think about your wellness like a wheel, a wellness wheel. And we often use the Grand Prix analogy, where if your wheel is not quite developed in every area, then you're going to be having a pup wheel and limping through life. So just think about the wellness wheel, and now think about your own wellness. What does your own wellness wheel look like? So we deal with wellness in 7 dimensions. You've got your body wellness, which is quite an easy one. Most people know their body wellness. Then you've got your occupational wellness. How is your wellness at work? You've got your soul wellness, mind wellness, emotional wellness, social wellness, and then at the center is your core purpose, your meaning in life. So now just spend a second or two thinking about each of these dimensions or spokes. And think, are you basically 1 to 2 on a spoke? Are you maybe 4 or 5 on a spoke? Maybe you 10 on a spoke. And think about how round your wellness wheel is, how well-rounded you are. And just quickly, as you're thinking about your wellness wheel, we get a lot of people and we do polls and we say, okay, draw your wellness wheel and just draw you these seven spokes from this wellness wheel. And each of the spoke is one of the dimensions. So as I mentioned, body, mind, emotion. And then put a cross where you think, or in your mind, put a cross where you think, say, your body wellness is. Maybe it's 2 or 3. Maybe you've got a backache. Maybe you don't eat so well. Maybe you always got a headache. Think about each of your own spokes. I'll just go through the definition of each one as you are thinking about your own wellness wheel. And I'll just spend a minute on this slide because we don't have too much time. So as I said, your body wellness, your optional functioning of living in the day optimally physically. Then your emotional wellness is your ability to cope with circumstances, to deal with personal feelings in a positive, optimistic way. So if, for example, someone says something a little bit negative and then you fly off the handle and you get really cross, maybe your emotional wellness needs to be a bit more well-developed through different ways, maybe having some more inner time, maybe some more meditation, various ways to help all these different levels. Think about your occupational wellness. Are you succeeding through your work? Are you feeling fulfilled? Or are you like, oh, you're not really interested in going to work? You don't wake up with a fire in your belly and you're thinking of changing your job. So then your occupational wellness will maybe be 2 or 3. Your mind wellness, your continuous promotion to enhance your insight, your wisdom, taking in information. What is your mind wellness? Soul wellness. It's the way you see yourself in the world, your ability to exist. And then meaning and purpose is where it all is integrated. It's quite hard sometimes to think about your meaning and purpose. Why were you put on this earth? And are you achieving why you think you were put on this earth? Or is it not something you really deal with, and then maybe it's 1 or 2? So just quickly, I'll just show you my wellness wheels. 2018, I was an amateur athlete, competing in the world champs in Edmonton, training twice a day, early morning, late afternoon. Very, 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 very many exercises, swimming, running, cycling. So my body wellness, 10. My occupational wellness, company doing well, hiring people, many clients coming in. So my occupation was 10. But you know what? My social and soul wellness, I forgot about, and I wasn't invested in them. Didn't have time for friends, didn't have time for family. My soul wellness, didn't have time for the greater God. Emotional wellness, meaning and purpose. So in 2018, I was sent a little bit of a curveball, and we all sent curveballs in life, and how well developed your wellness wheel is tells you how well you will deal with the curveballs life sends you. I was sent a curveball. I fell off my bicycle and I went into immediate coma. I had a traumatic brain injury and I was out for 8 or 9 months. So that was a definite curveball that life sent me. So I am now focusing on all the dimensions of wellness to ensure that I am as more balanced as possible to deal with what life sends you. Life sends you cancer, life sends you things. So be as well developed. Invest in every dimension of your life. And just quickly a definition, that's what I'm talking today about, the personal wellness. It's a lifestyle of personal self-responsibility, balance, and personal growth in all dimensions of life. So sit back and maybe those dimensions that are 2 and 3, maybe spend some time investing in those dimensions. And we work with Wellness Africa to help people on their wellness journeys. And then corporate wellness is also what we help people with. That is making sure the company has a culture of wellness. And what we suggest you do is think about how round your wheel is, how you are able to handle life's curveballs. Do you have any blind spots? I clearly had a blind spot. I thought I'm so fit, I'm so healthy, I eat so well, my business is doing well. But you know what? Those other 3 or 4 dimensions were my blind spots. So thank goodness the world whispered something to me, and I needed to ensure that I'm developing all the dimensions so that I'm not limping through life, but reaching my full potential of why I was put on this earth. So think about your own personal wellness. And you know what? One listener will get a free wellness assessment to see how your wellness is doing. Are you round or are you limping? Do you maybe have a spoke at 10 and all the other spokes at 4? So that's what we were able to give everybody, and then everybody else can email us to look at your own personal wellness. And we also take that into the company, doing a health risk assessment, but that's for a different conversation. So yes, think about your own life, your own wellness, and take the time to invest in yourself so that you can handle what life sends you. For example, Skills Train have a stress management course. Invest in taking the stress management course. It's 10 or 15 minutes. There's 10 easy steps to follow to decrease your stress levels, for example. They also have a Managing Wellbeing course, Skills Train. It's a great course, 20 or 30 minutes, and you are investing in yourself. They have over 2,000 courses in the health and safety and wellbeing space, and many are discounted offers with Women's Month. So invest in yourself and take a course or 2 and see how you can help your own wellness journey. And anyone interested, email Linda. I will give Linda's details in a second. This second, there's Linda from Skills Train Distribution. All these online courses at your fingertips, 20 minutes, 10 minutes. When you want to and have time, you can attend these courses to ensure that you are as holistic as you can be. Myself, I'm corporate wellness coach, Pella Wellness. If you want to invest in your own wellness, email me and I will give one person a free assessment. And then I need to work on this. Oh, okay, maybe that. Oh, this is how I can work on this. So that is me in a nutshell. I'm going to stop sharing my screen now, and all the best, and I look forward to hearing all the other great speakers talking today.
Thank you so much for that, Natalie. It was wonderful to see those slides and all that you're doing in a space of wellness, personal wellness. Our next speaker, of course, is Marisa Lowe. And Marisa, the floor is yours.
Thank you very much, Ernest. Thank you very much, Rudy. I am sharing a screen. Can you all see my presentation?
We can indeed. Thank you, Marisa.
Thank you very much. So I have a few slides prepared, and I can talk forever. So please, I am setting a reminder for myself as well, just so I have an idea where I am. So if I do look down, I'm looking at my clock. So a routine mammogram saved my life. And what I want to do is, as an individual, I want to bring a message out there that every woman, every person has the right to quality care and treatment. Now, what happened to me? I want to share my story with you. I was diagnosed in August 2019 with a routine mammogram after I went for my annual screening. So we have cardiological problems, in the family. And I go for my screening every year. I have my ECG and I focus on my heart because that's the problem that we have in our family. And I was at the time, I was 45, and I thought, maybe it's time to go for a mammogram. And my GP referred me to a radiologist. I went for a routine mammogram, being afraid of the experience because I didn't know what it's about. And I walked out of there with a report in my hands that read in big bold letters, 85% chance for malignancy by RAD grade 5. And I drove back home crying. It was about a 40-minute drive home. I did not know what to do. That initial shock was one of the worst things I've experienced in my life. I have since been through chemotherapy. I have received, sorry, I'm not reading on the screen. I've had several surgeries. I finished breast reconstruction in March this year. So it's a long process. I had many complications. So I'm also not the average rule of thumb. It is a rare, about 1% of cases my surgeon said has my type of complications. So I had to remove the implants again. I had to walk around flat-chested for 6 months. Horrible experience, but yeah, we'll talk about that at another point, because I do have another message. I just want to have you understand where I come from. And I've also been on Herceptin, which I'll tell you a bit more later on. It is a controversial drug because it's a life-saving drug that up to 2019 was not available in the public sector. If I have done my research correctly, if anyone has more information than I have on that, please do enlighten me, because to the best of my knowledge, it was only available in the private sector up to 2019. And there's still a lot of controversy around the availability of the drug for HER2 positive breast cancers. Then, because my breast cancer is hormone positive, I also received hormone blocking treatment. I have been receiving hormone blocking treatment for the past 3 years. I stopped last week because the side effects are, I just can't cope with them. I would love to speak to both Natalie's about mental wellness in the workplace, specifically pertaining to breast cancer patients on hormone blocking therapy, because there's a cognitive decline. My concentration is shut, my memory is, I've lost much of my memory. My short-term memory is totally gone. And that is a problem in the workplace. I am a freelancer. I've been a freelancer since 2011. I work in the marketing consulting space, and I find it a real challenge to manage clients because I can't even remember what they said after I put the phone down. And that's not how I used to operate. So there's many challenges that come with the breast cancer diagnosis and living with breast cancer. I know we have one of our speakers here who says she's a breast cancer survivor, and I would love to chat to her either later in this discussion or in a private session about calling it breast cancer survivor, because for me, especially because it's hormone positive, the treatment's supposed to be 10 to 15 years. How is that? How does that make me survive? It makes me someone living with breast cancer, and that's not the most pleasant experience. But there's many positives to what I can share, because I want people to be encouraged and to know that you actually have access to amazing care. So I've taken this paragraph from the National Development Plan 2030, and it reads, by 2030, the health system should provide quality care to all, free at the point of service or paid for by the, or provided privately, sorry, I can't see on my screen, apologies. Paid for by publicly provided or privately funded insurers, focusing on prevention, education, disease management, and treatment. Now, I see I'm running out of time. I really would like to just finish this on the next slide. I'm not going to talk about it a lot. I will ask Ernest to distribute this presentation to everyone in attendance so that you can read the breast cancer control policy. I think Conce mentioned it earlier about the control policies that they put in place in 2017. And yes, there's so much that government is doing and giving our people access to quality care. What I want to highlight is from that document, from the policy, the municipal clinics in your town should offer clinical breast examinations. So I live in a small town. We are about 20,000 residents, so it's not a big town at all. And I have been struggling for 3 years to get a mobile breast clinic unit in our town. We have so many people within our community who do not have access to the screenings. They don't know they can go to the municipality because our regional health departments aren't communicating that properly to them. So I think there's a huge gap that we to be addressed in terms of education to the people in our communities. We have several specialist breast units at our government hospitals, and they are world-class facilities. I was a private patient. I was really lucky and privileged to have a hospital plan that paid for 90% of my treatment. And, you know, those breast care units have the facility to treat you within 21 days, to provide you with verbal written communication. I speak to so many women who do not know what type of breast cancer they have, did not know there are more than one type of breast cancer. They have a right to that information. And my mission in life is to make people aware that they can ask questions, because knowledge gives you power to make the right decision for your body. And that's what I'm very passionate about. So I think I'm going to, because my time is up, I am going to ask Ernest to share my presentation. If you want to get in touch with me personally, I will gladly speak to you. I will gladly guide you. I will gladly answer your questions when I have a moment. You can reach me by doing a search for me on the internet. You will easily find me everywhere, or you can work through the e-center and you can reach me through the e-center as well. I thank you for your time. I can talk forever because it's really something very close to my heart.
Yes.
And yeah, I mean, thank you very much for the opportunity to speak.
Marissa, thank you very much for that. And I'm really pleased that your presentation, particularly coming from the patient and member of the public who has to access the services. It's okay for us who work in the system, provide services, and we can set out very clearly all the time what the policies are. But to hear from the public and, you know, how they view the services and where and how they view the gaps in services, most importantly, which in the end that we want the system to address. So thank you very much for such a valuable presentation.
Thank you, everyone.
Ernest, back to you.
Yeah, thank you so much, Marissa. That was really excellent presentation. And as always, you know, you leave us with so much to think about, you know. Rudy, thanks for that. Our next speaker is Raisa Rose.
I think on our part as the deaf community, I'd like to speak on the deaf community and people with disabilities. For us, it is a very big challenge to go into hospitals and not have an interpreter there. Even the frontline staff, such as the receptionists, aren't able to use sign language, and that's a big challenge for us in the deaf community. It is important that most staff members learn sign language or provide interpreter services. Another thing is using pen and paper. At times, there are certain medical words or medical terminology or jargon that's used that we as deaf people sometimes don't understand. And that's a big challenge for us. And I believe that as people who are deaf or disabled, we need to have more recognition and suitable tools to assist us in the medical arena. Thank you.
Thank you. That was a great presentation, because again, going back to my earlier point, is that we can talk from within the system, using the word inclusion, compassion. But again, what are we doing to improve the quality of care for everyone? So it's going to be interesting to hear as we go into the dialogue, whether there are any ideas from the other providers, those who work in healthcare systems, what they're actually doing for people from the deaf community and people with other kinds of disabilities. So thank you very much for that.
Thank you so much, Raisa and Rudy. Our next speaker is it's Miss Fumi. Is that correct? Yeah, Fumani, actually. My apology there. Miss Fumani, you can come in.
Good evening, everybody. My name again is Fumani Dipoto from National Union of Minemakers, where we are organizing in mining, energy, construction, and metal. But this evening, I just wanted to share with you how women and the social challenges are. As grannies and mothers, there are things that we are doing wrongly so, like domestic lessons that we have learned. As they say, charity begins at home, meaning that is where everything starts. Children in their homestead learn a lot from their families because that is the immediate surrounding they encounter. As parents, we don't respect our children. We fight in front of them, swearing and shouting. When they grow up, they think whatever happened at home is the path to follow. They grow up learning that to beat or abuse someone else is how you should love to the next person. And we are having ascribing gender roles, which I'm going to talk about a boy child and a girl child. When a boy child is celebrating his birthday, as parents, we buy the items such as gun, cars, etc. Guns are dangerous weapons, but by buying them guns, we instill in them a mentality that it is a must-have. But we give them such items without instilling in them responsibility, discipline, and accountability. Thus, when they grow up, they are inspired to have the real gun by hook and crook in their possession. But because we did not teach them responsibility and discipline, they go out to get guns and use this for wrong reasons, which included killing the next person for no justice reasons. For the girl child, in our families, we buy the girl child dolls for playing, which instills the role of motherhood caring. It also goes along with the expectation to be subservient in society. While instilling a sense that a girl child should take care of the family's responsibilities, we also teach the girl child how to assist in cooking, cleaning, and so on, while we don't do the same for boy child, which is wrong. And in socialization, after families tend to ascribe gender roles, which are socialization that goes beyond the homestead. This means that even in society, we have already allocated women and men special functions. This leads to gender differentials which favor men. Hence, South Africa has pervasive patriarchal practice, even though it is democracy based on equality. Due to the adverse socialization of gender roles and the patriarchal aspects of our society, when in many instances are paid salaries, wages less than men while doing the same job of equal value. This king socialization is also wrong because we subject the girl child to a culture of laboring. For example, in line with gender patterns about. For example, women in South Africa today, in terms of Stats SA, report on gender dynamics are far less likely to have driver's license compared to men. While women in the country are majority numerically speaking, but this affirms the gender disparities we create at the family into the society. Women's rights. Our children are misbehaving at schools, home, and in the community because of the laws that have been imposed. Our children are not respecting us as parents and teachers. We can't reprimand. They are expected to defer to elders, not to talk back to elders when opinions differ. We talk about poverty. South Africa has a population of about 61 million by June 2022. About 6% of the South African population, which is around 30.3 million people, lives in poverty, majority of which in women. Poverty affects women more than men when it comes to indigent households. For example, poverty was more severe on female-headed households compared to male or male-headed households. Women-headed families affected by poverty was 50% worse compared to 33.0 men pertaining to poverty effects in South Africa. This means there should be equitable intervention by government to give more support to women-headed households for us to be truly a democratic country that supports democracy and equality. The Constitution affords everyone that right to equality, women dignity, and a basic education. In 2013, around 99,000 learners in South Africa were expectant. So they will stay at home and not attend school because of their condition. But men and boys who made them pregnant continued in hundreds at schools. This is a paradox that women face in inequality. Hence, in many circumstances, men go on to study and qualify while girls or women drop out of school. However, because we are a constitutional democracy, girls are now allowed to come back to school after delivery in order to complete their schooling and not to be marginalized in oblivion. This is an important intervention by the education system in South Africa. This happens because penalizing learners because they fell pregnant is unlawful in South Africa. Again, we saw that there should be a vulnerability of girl children. Our children need support and assistance because they grow up in a country dominated by patriarchy and crime. 2 weeks ago, 8 young women were grabbed and raped by illegal foreign nations in Krugersdorp while shooting a music video. In this instance, you will realize that they were out there doing something positive per reports. They were doing something that is positive and adding value to their lives than roaming the streets helplessly. But still, they become victims to men. We must condemn this because it has pushed our girls to be afraid to take initiative. Desperation effects. In some instances, women due to desperation resort to be sex workers to sustain themselves and sometimes to support their families. Sex worker is not an easy job, and it must be difficult to make such a decision. But jobs are unavailable in South Africa is 35% unemployment level, more than any other country in the continent. We must not condemn women who are forced into such kind of jobs, but we must be sympathetic to them.
Kunami, 1 minute, please.
But we must do every positively possible to advise our children not to fall into abusive relationship with elderly men just because they want Brazilian wigs and expensive clothing. In conclusion, we must now support women and girls to access education because that is the only weapon by which to fight patriarchy, gender inequity. Must educate you girl and women to desist from the parasitic culture. As women, we must never give up but support our children on keeping away from these male hinds. Thank you so much.
Thank you, Ms. Fumani. Thank you. That was so pertinent. And I think you actually touched on very important points when it comes to girls. You know, we're definitely going to have a follow-up discussion around some of the issues you touched, you know, opportunities for girls and the difficulties they encounter in the workplace, and of course, which again, it impacts on their lives, you know. Thank you so much for that. Our next speaker, it will be Debbie. Debbie, if you can come in, please.
Thank you, Ernest, and thank you for the opportunity. I greet everyone again. My name is Deborah, as mentioned previously. I am going to get into spirituality and my journey when I was diagnosed with breast cancer. A year ago, I was diagnosed with breast cancer. Few months before, just before that, I dove into an intense worship. I couldn't understand what I was going through, but whenever I will find an opportunity, I will just get into worship, pray, and to a point that sometimes I will just play music so high and people will be distracted because the guards will come from the complex saying, no, Sisi, you are making too much noise. People are complaining. But I will just be, sorry, I'm just having fun. I'm just in mode of worship. I never knew I was in preparation for a day that changed my life for better. I would say it was for better because it drew me closer to my maker. Yes, it started badly, but I managed to keep my cool. I went for the test, then I got the results. On the day of the results, I was as cool as someone who knew about the results, even though I never knew because it was my first time. I totally believed that the intense worship helped me because I am a believer. I believe my faith helped me because I would say I rested and gave my results to God. I remembered a scripture when I was told about the results. Immediately what came to my mind was that this diagnosis is not coming to me to kill me, but it has come to glorify God. To somebody else, it might be something that doesn't make sense. You are diagnosed with cancer, breast cancer, and here you are saying this hasn't come to kill you, because most people, when you hear cancer, people just think of death. But at that moment, I remembered the scripture about Lazarus who died, and the sisters were panicking, saying that if Jesus was around, Lazarus wouldn't have died. But because God had to be glorified through the death of Lazarus, Lazarus had to die. So I took this as my diagnosis. I'm having this diagnosis. It hasn't come to kill me, but it has come to glorify God. So I continue living my life, believing that this is not a death sentence. I am going to live my life and I'm going to live longer. So after remembering all those, I told myself, even for me, this ailment is going to make me somebody whom God wants me to be, because I believe there's a reason for each and every pain, because in this pain, I managed to find a purpose. While I was going through the diagnosis, I remembered something that was dropped in my heart years ago, that I need to gather women who are going to tell their stories in order to heal one another. So this came back to my mind, and I was like, could this be the reason I am going through this? Because I am having a story now. is this story going to heal other people? Then it came to my mind that this could be the reason this whole thing is happening. Because I remember when I had the surgery, my surgery was so smooth, it went well, but it took a turn on the third day after I was supposed to be going home. I developed clots and I lost blood. I couldn't go home. I had to stay in hospital again so that they can check what exactly was happening, because I was losing a lot of blood. I'm trying to rush as much as possible, and I've tried to summarize this because we're talking about a journey here. A journey can be very long, but now because I'm trying to summarize, I am going to try my level best. So now I had to go to surgery 3 times within a space of 2 weeks because I was losing a lot of blood. Then after all this, I remembered that when God spoke to me about gathering women, he referred me to a woman with the issue of blood in the Bible. The woman with the issue of blood, who is from Matthew 9, verse 20 to 22. That woman had an issue for 12 years, but when she touched the garment of Christ, she got her healing. So for me, it was about that woman. But when I look at my situation, I realized that I have lost so much blood, and God spoke to me about a woman who has lost blood in the Bible. Then I realized I am the woman with the issue of blood. So now I had to tell my story as it is, because now there are women out there who would want to understand, how did you manage to cope with this? How did you manage to receive this news so calmly? Because most people get hysterical when they get such news. So for me, when I realized that this is the blood that I was referred to, the ministry of gathering women started. Today, as I'm speaking, from that, I managed to gather women that are telling their stories in order to heal one another. From my diagnosis, I changed it to something positive. Instead of crying day and night, being miserable that things have happened because I am unable to get to my journey as it is, because so much happened. I remember, people will remember when Charlotte Maxeke caught fire. I was one of the patients who were supposed to go for surgery. At that time, no one knew what was going to happen to us. We could phone, but no one would tell us what we can do. But eventually, I had to go to Bara. Then I got help there. But fortunately for me, my family's in Cape Town. They asked me to come back to Cape Town. Then I was helped in Cape Town. But all what I'm saying, my faith healed me. The doctors who were used by God helped me to go through my journey. But I thank God that through my diagnosis, Deborah's Conversations was formed. And today we gather and we heal our souls through telling our stories. I would like to encourage each and every woman who's going through pain to remember that through pain, you can get the purpose of God and the purpose that will turn around whatever situation you are going through. Thank you so much.
Deborah,
Thanks.
that was excellent. And you have reinforced the importance of faith and spirituality does have a role in terms of when it comes to our well-being. And it is an area for the next discussion, as Ernest has said, because especially when it comes to the mental well-being and being able to carry on that journey, the support of friends and family is so important. Being treated with love, compassion, and with humanity, again, is so important, that understanding. So that's an excellent story, and I can't think of a better story for which to end this particular Women and Girls Wellbeing Symposium. And I'm really pleased to, first of all, thank all the speakers and the participants as well, but also thanks to the other radio stations that will be rebroadcasting this message, so it will be going across the globe. So that's Women's Radio, as we've mentioned already. We've got Africa Global Radio, who are based in Accra, and we've got Ghana, Accra, Ghana, and we've got Fresh FM Radio London, based here in London, always connecting to other stations. We're always interested in health and well-being content from around the world. We're always pleased to host dialogues. And in fact, we look forward to you coming on some of the dialogues that we run all the time here in the UK, because having that broader diaspora involvement is important to us, and hearing the other voices as well. Yes, we're very much about the system and how the system operates, but we are really clear that the first goal of any healthcare system is to deliver high quality care. The second goal being it should be accessible, it must be accessible, and we must do our best so that inclusion is high up on the agenda. That's why I'm really pleased that we had the perspective from the deaf and disabled speaker. And Ernest, I would hope that in future we would also have people, representatives from within the system, who can come on to our platforms and actually explain how they are responding to the specific needs when it comes to inclusion. And there will be lots of other, I'm sure there's some good practice out there. So I think, you know, a good practice, knowledge sharing, where the system has taken on the most difficult cases and, you know, improve people's lives and their well-being in that way. I think that, again, that would have a lot more value to what we're doing. Because as we say in health here in the UK, because we have our challenges around inclusion, particularly for African and Caribbean population groups and other groups within society, that the reality is that people do have to take the maximum path of resistance from a system point of view, because there's always a level of indifference. So it's what we can do to assist those who think about that. And I'll go back to my final points. It's important people are treated with love, compassion, and humanity. And it's the best outcomes for all of us. So on that note, thank you very much. Ernest, keep up the good work and keep those spirits high. It is about your wellness, or our wellness first. And then of course we do think about others, but you know, it's important that we do think about ourselves and our well-being. So thank you very much, everybody, and good night. Thank you.
Thank you.
Thanks.